Hello, how are you doing today? My name is Maria Wanyabunwa Udenwa. Okay, in today's video, I'd like to share some information concerning drugs and medication. Okay, um, on this public health YouTube video, I'd like to say that there are lots of drugs and medications that have caused, um, the lives of people, especially prominent men and women who think that they can be able to take care of themselves. They can simply solve their problem without letting us know as caregivers or people who should assist them in time of need like this. Okay, some people have decided to self-medicate themselves, that has crushed their lives or reduced their worth to nothing, or something that have caused them pain as a result of self-medication. In today's video, we'll be talking about sildenafil tablets and what it has done to a lot of men who use this type of medication for erectile dysfunction. Okay, now sildenafil is the name of a drug that is used to treat or correct erectile dysfunction, in the sense that this drug, it belongs to a group of drugs called Viagra. Sometimes people just call this particular generic name of sildenafil. People commonly call it sildenafil, yeah, because that is the generic name. On the other side is that a lot of people misuse this drug. Most people too, they don't want to know the cause of their erectile dysfunction. They are only interested in taking this particular tablet orally in order to maybe satisfy their sexual concept and maybe get rid of it later on. They don't care about treating this particular problem once and for all. They keep on taking sildenafil tablet always, each time they want to have sex. And this has led to a lot of problems in this life. So I'm about to tell you one of the problems that result from consumption of this particular drug called sildenafil, or Viagra, as you may call their common brand name. So we say that sildenafil is a drug used to take care of erectile dysfunction. That is being said. But you have to ask yourself, this drug, how does it work? Okay, is it just taking sildenafil? Is that the end? It is not. You should know that it's not, because you always take the drug. Do you want to say that you want to depend on it? And that is actually no. So please, I'm trying to tell us that if we have any kind of erectile dysfunction, the best thing to do is to look for a good physician, explain the thing the way it is. Tell your physician the truth. Let the health workers know your problem. Not always taking this drug orally because you can have it or you can afford it. Okay, so please, let us just do the right thing at the right time. In other words, we have to know what actually happens when you take this sildenafil. And I'm trying to let you know today that sildenafil, as a drug to take care of erectile dysfunction, while you're taking it, this particular drug has the work of trying to pull blood from other parts of the body down to the genital area, like the penis, in which you want that penis to erect and allow you or help you to penetrate. Okay, so while you take this drug, as is pulling all the blood from other parts of the body towards the penis, is as well as trying to cause something in your body. And what does it mean? You see, so trying to pull all the blood from everywhere to a particular region, that should tell you that something should be wrong during this or after this. Okay, you don't know that taking this sildenafil can cause you death. And that is what I'm trying to tell you today. So please, if you're the type taking this sildenafil always, make sure you tell your doctor that you have, or you are having, or you usually experience, or you in the past, let's say for the past 6 months, you've had this chest pain. In the past 6 months, you've had any cardiovascular disease. Just to say, you've had a high blood pressure, low blood pressure, myocardial infarction, angina, or any kind of cardiovascular disease, that is that upon this problem, that the doctor has prescribed some maybe antihypertensive drugs for you to take. Please let your doctor know that you are on these particular antihypertensive drugs already. Before you take sildenafil, be careful and know that this sildenafil do not work with antihypertensive drugs at the same time. Please, my brother or my sister, if you have anybody who has this problem of erectile dysfunction and he has been on this sildenafil tablet always each time he wants to have sex, please let him know that sildenafil do not work with antihypertensive drugs. Antihypertensive drugs, I mean the beta blockers, the alpha beta blockers, calcium channel blockers like nifedipine, the ACE inhibitors like the lisinopril, esinopril, all the pril groups, you see. So any of these drugs that you are taking at the same time with sildenafil, please tell this person that he's about to die. Because what happened is this: when you take the when you have, let's say, any chest pain, or you having this cardiovascular disease, that your doctor have prescribed this and one of these antihypertensive drugs for you, is going to reduce the blood pressure, reduce everything is coming down. Now you take sildenafil. Sildenafil is as well as pulling blood from other parts, from all the high areas to down the like to the pennies. You see, so everything is going down. That is why when you take this drug, take antihypertensive at the same time, is going to react. You are going to have a bad effect of it, or you're going to have, in fact, you see, it's just to say that lots of people, people who take this drug, they die after sex or during sex. They don't know that they have combined these two drugs together. So please, I'm telling you today that if you know anyone taking sildenafil always, please let him know that no one takes this drug with antihypertensive drugs, because the adverse effect is going to be disastrous. No one comes out of it, because most time, before you could know it, even the girl you are doing this stuff with may not be able to identify what the problem is. You see, the man might be doing this stuff, along the line he may just do he'll just collapse, because everything has gone down at the same time. Okay, so the next thing is that you have to let your doctor know some of the side effects of this drug, so that he will be able to tell you what next to do. You don't just obtain or purchase sildenafil tablet for yourself. It's not good. Please let your doctor know that you want to take this drug, okay? And with that, he will be able to tell you what to do and what not to do. Remember that sildenafil tablet is good when you take it like an hour before you have your sexual intercourse. Again, do not take it too many times to say this one is not working, or you want to have sex with 5 women at the same time and you say, oh, let me take more so that I can have that energy. Please, there is no energy coming anywhere. You are just like trying to kill yourself. Please tell whosoever you need to tell, and let your brothers and sisters know that sildenafil kills just through this means. Okay, and nowadays people just die, and they might call it coronavirus, or they might call it something else. Some people in some part of the world say is is a spiritual thing. Please, there is no spiritual effect with sildenafil and its combination with antihypertensive drugs. Okay, so please do the needful, take these drugs the way it should be, and be careful if you have had any sign of stroke, kidney disease, liver disease, like anything from the cardiovascular area, or you've had eye problems in the past, because these drugs affect your eye when you take it. You see, it causes dizziness. You don't take it and drive at the same time. So please, let us just be careful about taking drugs anyhow. Report chest pain after taking the drug. Let your doctor know what this drug has caused you, and let's know the right thing to do. Please, if you have any erectile dysfunction, make sure you take care of it. Take care of it, my brother, because sildenafil tablets will not solve your problem. It's just for that moment. Okay? Yeah. So do the right thing. I believe from this video you are able to get something, and you are also ready to tell someone else that this is what you've had today or you've learned today, and that is how you can save a life. We are public health workers. We make sure that people's life, are protected, and the life of the public as well is protected. So please, let other people know that they don't just jump into some of these drugs for any particular reason. They should let us know before they take it. Thank you for listening, and if you've not subscribed, please do that. If you know that you like my teaching today, you can as well like my page. Thank you for everything. Thank you for listening.